I didn't pay attention to much when it came to my health. I was one of those lucky people that never had a reason to. Bad things weren't going to happen to you. I was young enough. There was no reason to really focus or pay attention to anything other than just living life day by day. One day it just changed. I went up to use the bathroom and I came down in extreme pain. And at that point, I was rushed to the hospital.
I can only imagine how much her life was being turned upside down. She had just had a baby, and she was given a really bad diagnosis of stage 3 ovarian cancer. The track record for that particular disease is pretty bad. Most patients don't survive a year.
When they give you the kind of time frame of a year to live, every 24-hour period became so important. I had to build up as many memories as possible that I thought my daughter could consciously hold on to and remember as she grew into an adult.
The word genomics means the study of human genomes or human DNA. Historically and classically, when we treat disorders like cancer, we take a generic approach where we treat everyone based on physical presentation of symptoms that these patients carry. What we can do now is dive a lot deeper, dive beyond your standard diagnostics and microscopy and pathology to the level of DNA, where we're able to identify some of those unique DNA features that oftentimes can be unique to an individual patient. And we can use that information now to specify targeted therapies that are unique to those specific features.
For some people, genomics is integral to their care from the very start, because we can offer them a treatment that is very much tailored to their type of cancer, where we can expect high response rates and a well-tolerated treatment, as opposed to some of our treatments available in the past, which were less discriminating, were more likely to cause a broader range of side effects, and maybe were less likely to produce a response.
I convinced our pathology department to test her tumor for the presence of the HER2 protein. Ever since then, she has had clear scans. She tolerated the treatment very well, and here she is going on 8 years later, doing very well. Something that we would not have expected based on the knowledge that we had about how mucinous ovarian cancers usually behave.
For me, who had been given a year to live, the idea of making it 10 to 15 years meant my daughter would be 16 to 18 years old. She would retain those memories. She would know exactly who I was. She would be able to reflect back and even smell me if I wasn't there anymore. And I think that gave me all the hope that I needed to know that I was individual and I was never sort of the norm, and that if it was the last thing I did, I was going to get up, I was going to fight this, and I was going to find a way to get over this disease, working with my doctor and hoping that it would save any other woman in the future from having to experience or go through anything like this.
So I think Melissa is a really good example of where we need to go in oncology, is not just look at this is a patient with cancer X. Learn more about cancer X. With the gene sequencing, we can learn more about the cancer and then take chances on different therapies that we wouldn't otherwise think about. And I think that that's how we're going to get to better.
And so for us, taking as an example a single donor dollar, we can very quickly leverage that through public grants, through commercial grants, so the $1 becomes $2, probably $4. Now we're working with $4 to invest in care. We can then work with different government groups and large-scale grants to suddenly bring that $4 up to $8, maybe beyond that. So the $1 is now at least 10 times the impact to be able to create new access, prove the benefits, then influence the health system as a whole to make this a routine standard of care. And that's what the Verspeeten Clinical Genome Centre does.
The key objective for this center is to provide personalized and tailored genomics-based care to a larger fraction of patient population. and then influence others, whether or not it's our ministries or in a commercial setting, to take Canadian innovation and to be able to, more broadly showcase it and provide it to the rest of the world.
March the 13th of 2013 was the day that I was officially diagnosed with a terminal aggressive form of ovarian cancer.
I want you to tell me what the date is.
The date is April the 7th, 2021.